She just can't organize herself. He doesn't want to study. Plain, simple, lazy. What might seem like a habit could be more than that. Growing up with attention deficit hyper disorder, ADHD, comes with its set of challenges and rewards. Learning how to focus on these rewards while managing the limitations can be the game changer. As we begin today's talk by Dr. Monalisa Palit, Senior Consultant, Clinical Psychologist, Vimhans, on the much misunderstood condition of ADHD, we have one request, besides, of course, asking you to keep your phones on silent. Let us put aside our judgments and listen in with an open mind to enable better understanding and support to our own self and those around and close to us. Dr. Monalisa Palit, a Ph.D from Sydney, is a licensed practitioner with a specialization in child and adolescent mental health issues and developmental disabilities with over 20 years of experience. She is currently engaged as a senior consultant with Vimhans New Delhi. In the course of her career, she has come into contact with a diverse population whose learning and social emotional functioning levels covered a wide spectrum. She has provided therapy for individuals and families on clinical and non-clinical issues, including but not limited to psychiatric conditions like depression, anxiety, conduct problems, and personality issues. She has an eclectic approach to psychotherapy, which allows her to fit each client's needs uniquely. Furthermore, she conducts workshops for schools, NGOs, and corporates on a wide range of topics, varying from awareness building to clinical training. She is currently also heading a structured and well-regulated training program for school counselors in collaboration with ICMR, HHSC, and Vimhans. The program comprises a rigorous training curriculum and hands-on training in assessments and counseling skills, aiming to enhance professional expertise, help close the treatment gap, and strengthen preventive, promotive, and rehabilitation services. Our partner for this talk is the Mind Diaries, the first of its kind magazine in India on mental health and well-being. The magazine, which has been running for close to a year, aims to create awareness towards mental health and normalize seeking expert help. Besides first-person stories and accounts of fighting back, there are expert columns, inspirational stories, and more. Before we hand over to our expert, we request you to please keep your questions ready for our question and answer slot scheduled for the end of the session. Over to Dr. Palit.
Good afternoon, everyone. Thanks to Internet and Google, we all have some basic knowledge on lot of things nowadays. So in that context, before I start today's presentation, I would like it to be interactive as much as possible. And when we talk about ADHD or attention deficit hyperactive disorder, anyone would like to say something that they have understood what it means? Anybody wants to open the discussion? Yes, please.
People who cannot concentrate for long periods of time, they find it difficult to focus.
Okay.
That's all I know about it.
Alright. Anything else? Yes,
The
please.
attention span, the retention of the things is so difficult, and sit at one place and focusing on things is so difficult for them. Because I work as a mental health counselor specifically for poor communities, and now the the cases are coming who are neurodivergent poor, and more of them are ADHD. And
You're working with specific school setting?
No, I'm a mental health counselor with Keshav Suri Foundation.
Alright.
So to learn about it, I have come here.
Alright. Anyone else? Okay. Let's start with what is not ADHD, the myths that we have.